Good morning, everyone. It's a great pleasure to introduce our guest today, Christopher Sethness. Christopher is a clinical psychologist from California with more than 20 years of experience in the field. He earned his PsyD at the Chicago School of Professional Psychology, where he studied with Todd Dubose and first discovered Heidegger and Daseinsanalysis. After more than a decade leading mental health programs in an integrated medical setting, he opened his private practice, now dedicated to existential and Daseinsanalytic therapy. He's a member of the American Daseinsanalytic Institute and part of its first cohort of students. Today, he will share his reflection in the talk, Daseinsanalysis as the highest form of respect-giving therapy. Tales of an early career believer. Welcome, Christopher. We are very happy to have you with us today.
Roberto, thank you. And good morning, everybody. It's nice to see screens and some faces. Very good to have you here with me this morning. I want to say, thank you for making time for this encounter. Everything we do requires this giving of our time and our temporality to things. And I thank you for giving me your time this morning. And I hope to have some dialogue with you today. So I'll be presenting a little bit about my journey with Daseinsanalysis, with ADI, a couple concepts that I would imagine many of you are very well familiar with. But I want to recap and highlight the things that I think have been most important in my journey and the things that I feel very strongly about, as we continue to grow and hopefully expand on this incredible practice that we have found. I know you've had other visitors from our American Daseinsanalytic Institute, Miles, of course, Ron, Rafi, Beza, Matthew, Pedro, maybe several others. Of course, Roberto has been leading this cohort. Really amazing people and amazing leadership. I've had a chance to listen in on several of those lectures. Boy, these folks know their stuff. Heideggerian scholarship, philosophical foundations of therapy, even talking about art and media and film and reflections of life that we can see in different places and spaces. And I really hope that today we can start to talk a little bit more about, what is this idea of phenomenology, and not just an intellectual term, of course, but how is it lived? How do we actually dedicate ourselves to that in Daseinsanalytic work with people? And not to disappoint any of you, but I don't consider myself an expert by any means. I would be a layperson, and I may not have very many answers for you. Maybe that's shocking. Probably not, because you're all here. But we have questions, we have a lot of questions to ask. And I want to tell you a little bit about my questions and then hear from you all about your perspectives, your growth, what it means to you to be, a part of this practice. I can say, this has been life-changing for me, and that's not hyperbole. This is something that, we may explore in terms of a calling or in terms of something that reaches out to us. But I feel very much in its grasp, so to speak, of, it's just something that has been inspired and really driven a lot of my most recent chapter in my work, which has been private practice, which I'll talk about in just a second. So a little bit about me, just so you have a sense of who this guy is. I currently am in Santa Rosa, California, which is about an hour north of San Francisco, all the way out here on the West Coast. It is just after 6 in the morning, so forgive me if I'm a little groggy during this. Try to muster all my early morning energy to give you this presentation. I grew up outside of Chicago, Illinois, which is in the center of the United States. Went to my undergrad at the University of Illinois, which is about 2.5 hours south of Chicago. So you go from a very populated, of course, I think third largest city in the United States, to farmland, rural, middle of the country, cornfields, and really sort of salt of the earth people, but a large campus, about 40,000 undergraduates. University of Illinois is a pretty traditional, research-heavy school in terms of psychology. So they are not of phenomenological or philosophical tradition. They do basic research. A lot of many of you might be familiar with water maze studies, and if you're not, in very brief, you're basically watching a rat swim in a small tub pool, and the question is, does it remember where the little platform is to stand? You know, and you time them and you watch them do this, and you learn something about memory. I don't know what exactly, but apparently it's important. They do it a lot. And they did some brain imaging research. Of course, it was kind of the boom of trying to find out if neuroscience could solve all of our problems. So this was part of the experience. I will say those experiences, for me at least, were not making me drive as fast as I could towards psychology. I was actually just quite uncertain about that. I enjoyed creative writing. A lot of chemistry classes actually were just part of my major at first. But later in life, I found the Chicago School of Professional Psychology. Had a really close friend go there. He went straight out of undergraduate. And he found a lot of inspiration in their approach, especially he was more of a psychodynamic tradition, but found a lot of philosophical texts and different reflections on life. And that was inspiring to me to talk with him and have a lot of dialogue. I joined the Chicago School in 2007, and my mentor there was Dr. Todd DuBose. I'm not sure if folks are familiar with him. I'll talk a little bit about him today and some possible ways you might connect with him. It's great to have Miles here. Miles was a mentor of Todd as well, so very cool to have that. Todd was my introduction to Heidegger, Boss, R.D. Laing, Thomas Saz, Rollo May, Victor Yalom, and Viktor Frankl, Irvin Yalom and Viktor Frankl. I had never heard of phenomenology until Todd, hermeneutics, other ways of knowing. And in that cohort, they essentially want to train people that are quote unquote eclectic. So you do rotations in CBT, psychodynamic, family systems, and then humanistic existential, and then you choose a track. So I chose the humanistic existential track, which allowed me to do a lot more study in this particular area. 2011, I did my internship at University of the Pacific, which is a college counseling center here in California. In 2012, I did my postdoctorate degree or postdoctorate study with Kaiser Permanente, which is basically a very large medical consortium. They have everything. It's a one-stop shop. They have hospitals, their own insurance, medical centers, specialists, so you can do it all. The place I was positioned at had psychiatrists, therapists, probably more than 50 providers in total. They ran groups round the clock. So they were heavily trained in DBT, a dialectical behavioral therapy, which was very big at the time, still is probably to this day. They ran depression groups, an IOP, which is, of course, intensive outpatient program. So you attend 3 to 5 days a week. Basically, you're in group setting class for much of your life, I suppose. A lot of different styles of therapy in the leadership there. ACT, EMDR, mindfulness was a huge push. So everything is about meditating, getting apps and spending time. A lot of breathing training, for example, and skill development, really heavy in terms of, giving you something as you walk out the door was the assumption. Got to have something. In that time, I was blessed, I think, to have a sort of a carve out where part of my time was spent going to a local FQHC, which is a federally qualified health center. It's a place where a lot of patients on, let's say, low income or assistance could get medical care through the Obamacare system. I taught bedside manner to family residents, so people early in their career coming in to learn about medicine and how to be sort of a general practitioner. This is where I actually had over a decade of my career, so I was hired on as a psychologist there. Many of you might be familiar with the behavioral health approach to therapy. I'll talk a little bit about that in the context of a little bit of contrast, direct intervention care versus way-making care. But this was heavily emphasized in the medical setting. These are brief sort of interventions. Essentially, you're carrying an on-call phone, and the clinic will call you. Some PCP will give you a phone call and say, "Hey, I have someone in distress. I need you, come down here and fix this problem." And so you pick up the bat phone and you rush to the exam room and you intervene. You sit with them and you talk with them and you offer them something. Maybe it's an appointment, maybe it's a skill, maybe it's your attention and your time. Maybe it's even a psychiatry referral, for a medication, or at times it might even be housing assistance information or food stamp program information, or kind of a social work capacity of support systems in the community. What else could I say about that? A lot of course, treatment planning. So I don't know how many of you work with third-party payers, insurance companies, or other third parties, but the requirement of the treatment plan, what are you doing, medical necessity, these are all sort of subcomponents of that system. In 2022, I met Miles and Tomas and was invited to be part of the cohort at the American Daseinsanalytic Institute. Have been an active participant ever since, excited to where we've come from and where we're going. A lot more to say on that as we go. In 2024, I left the health center community and started a private practice. So I've been on my own, doing my own thing for about 2 years and loving it. It's really been a lot of transition, but a big step into being able to do the kind of work that is inspiring to me. And so that's just an overview. Gives you a little sense of who I am, where I come from. But what I really want to spend time on is what Daseinsanalysis has meant to me, and talk a little bit about the importance of phenomenology in terms of what it tries to do for people. Daseinsanalysis is really based, I think, on an invitation, to have someone come in and we can take a closer look at their life together. We have to have faith that Dasein to Dasein encounters have the capacity to explore freedom. This is one of the assumptions that we have, one of the understandings that we have. This happens because phenomenological exploration with free association of a person describing their lived experience creates a unique respect-giving encounter of being with. What I want to talk about today is really about why I believe this is the highest form of respect-giving. It's one of the greatest ways that we can show how someone means something to us. And we'll talk about way-making a lot today. But to not assume things actually takes a great deal of patience and willingness on behalf of the listener. We cannot invite people in and then shame them or bring harm to them in our judgments, even ever so small, in our facial expressions or our the ways that we communicate with them. Husserl, of course, talked about the suspension of judgment, refraining from conclusion. These are key elements, at the heart of phenomenology, what Heidegger was studying with him. Modern day, and even then, they talked about this in forms of bracketing. I don't know how many of you know Ernesto Spinelli. He has a lot of writings on bracketing, getting out of the way, being able to suspend our assumptions about what's going on, our own definitions of what things are, including the person in front of us who may be presenting, or talking in ways of symptomology or classical DSM or ICD-10 sort of terms. Of course, how we comport ourselves matters in the way of the therapy relationship. We must be willing to be brave and accepting and open to all possibilities. These are sort of maybe obvious statements, but they're very hard. So we're going to break some of these down a little bit. And I have some long quotes which I will read, but I also wish to post in the chat, so I'll try to do that now. This next quote comes from Why in the World Not, which if you haven't already, this is a text by Miles. This is a newer text from last year. And I'll be making several plugs for different texts for what some of you may already know, but some places to go. So I'll read this for us. This is from Why in the World Not. This is discussing some key approaches to the relationship. And it begins, how does the conversation described prepare the ground for the analytic event? And just what is the analytic event? So boss is being asked, well, what is happening? Actually tell us what's going on. And as Miles has translated, staying with the phenomenon, dwelling on it, not only rejects the tendency to pass over what is revealed in favor of what is hidden behind it. It is also an instruction about how the analysand's messages should be received by the analyst, namely with deference and respect. Such understanding is not about a mere enrichment of knowledge, about seeing through what was previously incomprehensible. At the very least, knowledge for knowledge's sake always has the mark of distancing itself from what is revealed. In the phenomenological sense, to dwell on the thing, what matters, means to accept it as something that has a claim to human understanding, to be allowed to unfold in this understanding in all its particularity. The being together of analyst and analysand is not primarily based on the will to jointly gain knowledge about the analysand, to make the unconscious conscious, but to give him acceptance as to who he is. The analysand is not so much an unknowing person as one who is unable to accept himself in a whole range of areas of his ability to perceive and behave. This to me is a core takeaway, because what it's talking about, and I think sometimes this is lost and even difficult for myself, is that we are not after just knowledge. It's not just about what you receive from someone. It's not just transactional. This is about relationship. It's about the being with. So it's not as much an intellectual exercise as it's a relational encounter. Being together is not just about the reveal, let's say, of you're going to learn something about yourself. Although I will say I think that does happen quite a bit. But it is in the experience of being with another that something very special and very beautiful happens for the person. Todd DeBose and so many others, but he also writes about Lichtung, and he has a chapter actually in this text. I don't know if people have seen this one, called Being Therapeutic. This came out this year, just recently. And Miles has a couple texts here, and also some others from around the globe. But he says, Lichtung is co-constituted by the dexterity of our releasement, Gelassenheit, or how much we can let be what shows itself, what calls us, and whether we are willing to companion with others as we follow phenomena wherever they may take us. Post this again in the chat. But the idea of companionship, of being with someone, again, a strong emphasis there. I will say it takes a keen awareness and practice in holding back, not to lead the witness, not to encourage or share an agreement with something that remains unknown, even nodding to people, sort of positive reinforcements of things can sort of encourage certain things, right? Do we really understand what you're saying? Do I really get you? Have I taken the time to give you that respect and to listen to what you actually have to say? We really cannot be afraid to slow down and to hear what the meaning has to say to us. This requires we give up something of a predetermination of where we're going. So from the health center and from a lot of the traditional medical models of practice, these are creating an understanding that care is a linear process, right? So you start with an assessment, you formulate some diagnosis, some categorization of what's going on. You then apply a treatment, maybe quote unquote evidence-based or empirically validated, whatever that means, by the way. That's a whole nother lecture. And then hopefully you feel better. There's a cure, there's a restoration to some baseline of quote unquote health. Essentially, the assumptions here are that you can take in certain data points, you can understand something and conclude something, and then you can recommend something. You can move the person along to a recommendation, a predetermined route forward on getting better. And this is what I find, I think, is that this is a very seductive and lures you in kind of a practice, because it makes you think, if you're experienced enough and smart enough and trained enough and can diagnose well enough, that you're going to know what to do, that you're going to have a solution, that you'll be able to correct something for somebody. And of course, if I need surgery, I hope that they are doing that. I hope they have those beliefs and are, making those recommendations. If classic examples, right? If I have a broken arm, you know, I don't want to talk about it. I want you to, you know, put a cast on and set it and take good care of me in that way. This is not bad, is what I'm trying to say, of course. But it is a choice, and it is a strong and determinate position to take, and something we have to be extremely mindful of in therapy. I'll give you an example from behavioral health. So a classic referral for that system would be someone who wants to quit smoking, you know, and most often what that really means is the doctor wants the patient to quit smoking. The patient doesn't want to stop smoking. So they say, you know, come in here and tell this person why smoking is bad for them, which pre-assumes that the patient doesn't already know smoking could be bad for them, cannot read, you know, a Surgeon General's warning on the label, that hasn't been, you know, aware of certain research or whatever. But a behavioral approach would be something like motivational interviewing, which I imagine many of you are familiar with. You basically are trying to have the person tell themselves why they're ready now to quit. So they move from what's considered a contemplation state of change to an action state of change, to take a small step in the direction, maybe harm reduction. You know, don't smoke a pack, smoke 5 a day instead, and we'll consider that a positive outcome. You might coach them on mindfulness. You might teach them emotion regulation skills, breathing, grounding techniques, pros and cons lists. You might even do thought records. I don't know how many of you are familiar with the classic CBT thought record, but you basically map out a person's thoughts and feelings, try to connect it back to core values, and then show a discrepancy in what they're thinking versus how they're behaving. And in all this time, you're making them feel bad, and they essentially feel that they're failing you because they're not going along with the protocol. And then all of a sudden, the goal in therapy has become about what the therapist wants or what the physician wants, and maybe what the patient wants, but only maybe. And we lost something along the way. And if every week I see that person, I start my session with, oh, how's it going with the smoking? You know, how you doing with that? I'm already starting to map out what's important to them, rather than letting them speak to me about what they want or need in their life. I've taken away their agency and their freedom, even if I have quote unquote good intentions about what I think is better for them or healthier for them. But I haven't even started to look at what the significance might be of their relationship with smoking, what the ritual could be for them, why it's meaningful, why it's a choice that matters in their life. And I am by no means, you know, promoting people go out there to smoke or anything like this. But I think we have to be incredibly careful about how we judge or shut down people's possibilities in living. And this happens subtly and a lot of times without notice. And that's why I'm talking about this alternative form. So we really owe it to the other person to allow them to speak to the meaning of these experiences. As you all know, phenomenology, Daseinsanalytic work does not conclude much of anything, but rather returns again and again to an opening and a temporary understanding of what is, so that we can remain willing to see the dynamic and possibility-filled existence of the human as a forever unfolding being. So even in that week to week, we have no idea who we're meeting in that next encounter. We have to get reacquainted. We have to get to know them again. We are inconclusive in our nature. And as you've heard, again, in many other places, it's not to say that interventional care is bad, but it is specific, and it's not universal to every form of care. we want to also look at this way-making, looking after care as well. And I'll talk about that in just a second. I want to pause here in case there's any questions or comments people want to make before I go into this alternative way-making care overview.
Thank you, Chris. I think I have one question. When you were at the healthcare center, you have these callings of, oh, you have to fix the problem. You have to fix this person. How you do back then when you are not in private practice doing Daseinsanalysis, but are there any way of respect given in healthcare centers? How do you experience this back then?
Great question. And I will say this changed a little bit over the course of my time there, over a decade. So in the beginning, as a very layperson psychologist, every therapist in the building had a rotation. So I'd have a shift, actually two of them a week, where I'd carry this phone for 4 hours, basically, each shift. And it was available to the entire clinic. So my clinic might have 30 or 40 providers going at any given day or shift. And so any one of them would call this one phone, and then I'd come down. And if I heard your question right, you're asking, how do you even bring different forms of showing up to those calls, and there's a third party involved in those calls as well, because the patient, the analysand, is not calling me. The doctor is calling me, or in most cases, the MA is calling me on behalf of the provider. And so oftentimes I would ask the provider to tell me what they are encountering and what they want to do in the first place. That was varied. Some providers knew what they wanted. Some providers did not know what they were calling about, but they wanted to call anyway. Notoriously, there was a provider that would call anytime a patient would start crying in the exam room. So if there were tears, you get the call, And so I don't know if I was supposed to bring tissues down or, I'm not sure what exactly. So, you walk into the room and really you're in this very fast-paced experience of trying to make a small connection with someone, while also trying to maybe again give them a resource. Or what I found, and this was me, which is why I think I was taken off of this rotation, by the way, is because I would often offer them an appointment with me to talk more about what was going on. So 15 minutes, 20 minutes, I did not feel that was enough to really understand all of what was going on, to even give them much of a suggestion, let alone there were others who took on kind of the mantle of behavioral health practice. They'd come in with binders, worksheets, handouts, small interventions. They would do a lot of on the spot mindfulness, so let's regulate your breathing, for example, for 10 minutes. And that sort of thing. I always thought that, and this is kind of telling probably why I'm here, but I always thought that you really owed the person more than that, and to really give them the space and time to speak and to hear from them if they were interested or not from someone else trying to get them to change something. If that answers your question.
Sure. Do you have a feeling that you are doing already a sort of Daseinsanalysis before you get in the program? Because you are talking about the highest form of respect given, and you are telling me, hey, you are crying. What I'm supposed to do? Just bring you a tissue and and wipe your tears off, but you are interested even further in the experience. You want to know more. You want to talk. Do you get the feeling that you are that you were doing a sort of Daseinsanalysis before you were doing
Yeah.
Daseinsanalysis, you know?
Yes, I'd say in the sense of the curiosity. I think I've always had that and been drawn to that way of caring for people. I think that most people that are called to this, you know, it's not easy to find. So you have to want it and be called towards it. And I think that, you know, certainly that shows up, I think, from the start of therapy. You know, the first time you sit with someone, for example, what do you feel from what you're doing? Why are you there? You know, there's a lot of theories about therapy, of course, but what you feel and experience in the encounter itself says a lot about who you are, I think, and whether you're trying to fix something or whether you are trying to allow space for another person. These are very, very different agendas, you know, and both may be with the intention of support and helping people. I don't think that behaviorists are bad people, for example. I don't think that at all. But I do think they have a very different agenda in therapy. And I think they've been led to believe that that's the main or most important way. And I think that's what we're here to question, is whether or not, you know, there is room for this very important other way of being with.
I got the sense that that's what we might call calling, you know, like when you're doing what everyone are doing, you say this is just not enough, you know, and you got this. I think that you got this sense of, I want to know more. I want to know more about this person experience. I want to know, you know. Do you consider this as a? I don't know if you want to talk this along your presentation,
Yeah,
but you
let's
consider
hold
this
that
a calling?
yeah for the end, because I could probably take all the time talking about that, which is fine too. I don't mind abandoning pre-written slides or whatever to talk to you all. I'd actually be curious to hear from some of you as well about your experiences and what you've tried, because as I mentioned about Kaiser Permanente, you know, I did a year's worth of training in DBT, which is to say you go through the entire Marshall Linehan catalog, and I don't know, that's pressed heavily in some circles as a again, a very strong treatment, skill development sort of reservoir, if you will, of information. So many worksheets, right? They have manuals and books on how to teach the manuals, you know, so you can walk people through all 4 modules of DBT, for example, which includes mindfulness and distress tolerance and interpersonal functioning and other things. And a recommendation there for Miles of Thomas Sauce. But the you know, what is the goal there? Again, it's a very much a not just an invitation, but often this is what you need. It's prescribed. You have a deficit in these areas, and you need to do something different. And this manualized work will help you gain those skills. And that's not to say, again, that some people don't benefit from these things, but it's a certain way of benefit. It's a certain way of growing, and what we're trying to do with Daseinsanalysis is very, very different, because the starting point is different. So as soon as you start with skill development, you've already started somewhere else, and you know, that's something we want to keep highlighting. Maybe I'll go a little further. We can come back to this and can hear from others about their experiences too. But I have these are some additional recommendations. These are way more detailed overviews. I'll add them to the chat. of where you can find some pretty good resources. There's about, I mean, while it's less common here in the States, of course, internationally, it's probably more common. So you've heard way more maybe than even I have around some of these topics. But these are some recommendations, several from Miles, Heidegger and the Future of Psychotherapy. Of course, Why in the World Not? I shared that with you earlier. Miles has a two-parter on Volo ut sis, Therapeutic Eros in Daseinsanalysis, is a great read. And then Charlotte Aigner has a presentation to the World Congress that I think is phenomenal. Highlights a lot of what Miles also talks about. And it's Miles translated it for us, so we have at least English access to it. And she says in this lecture, here are two more quotes that are kind of about these concepts. I'll post them also in the chat so you may read along as I say them. But she says, Dasein is the perceptively open place of appearance for the presence and the unfolding of all circumstances that appeal to it and that are possible for it. If a person realizes this and is able to face and stand up to what is shown and spoken to, and to respond to this encouragement in an independent and responsible manner, then he is found to freely carry out his very own attending and compliance to the possibilities of healthy existence. However, not only the sick person, no, each of us, so we all, are entitled to free ourselves to actually be ourselves, which means to freely fulfill our own possibilities of being, to live, to be as we basically are, everyone in his or her own way. Gemeinig, as Heidegger says, and I probably did not pronounce that correctly, which means that our existence is about this itself. It's about to be ourselves. Aigner and Groth and others talk about Heidegger's reflections on Augustine in many of his lectures. And this is Aigner's translation. Miles has one as well, very similar, but probably the deepest interpretation of what love is found in Augustine. This is Heidegger's description, by the way. In the words, amo volo ut sis. I love, that is, I want what I love to be what it is. Love is letting be, in a deeper sense according to which it evokes the nature of the other. Allowing someone to be themselves is the greatest gift we can give another person. And this is the respect giving of Daseinsanalysis, is that at its core, the relational encounter is allowing someone to be themselves without this directionality, without presupposing where they're supposed to be. Even if we consider sort of health research, you know, our goal is not to tell them that they need to be somewhere that we could recommend them to be. This is perhaps where ontological existential Befindlichkeit, how one finds oneself at a given moment, relates to the purpose of respect giving in therapeutic relationship. In this way, we really need to avoid opening phrases like, where did we leave off last week or earlier this week? And not take the bait when this is offered by our analysans. I know for myself, I have to practice being silent and not giving them answers to that question. Like what were we talking about last Tuesday? You know, and it's uncomfortable at times to leave them hanging, but it's essential. It's important because I'm not sure that picking up where we left off is the most important thing. And in fact, it may start to encourage this belief that we are linear, you know, that we are moving in a linear past, present, future way. And instead, I'm way more interested in what is showing up today. You know, where are you now? And people sometimes want to be bailed out of that question. And I think in respect giving, we don't bail them out, but we sit with them with that discomfort. We respect them so much that we must respect that we need to reacquaint ourselves over and over again, because to make room for the possibility and the likelihood that they are not the same person. We are not the same person. The encounter is not the same. And we don't want to pretend that it is. We never take them for granted if we're to meet them in this way of absolute welcoming. This is very hard because we have to actually face our own anxiety in doing this. And I know from personal experience, it's tempting to want to, even if you have to take chart notes, for example, for a third party, you have all these records, you know, a story is developing of sorts about this person. But what does it mean? And if you're just looking at, well, where did we leave off? And you're already sort of setting up a tone or an expectation of where we're going to go. And that closes down possibilities instead of opening them up. It can be somewhat scary, I suppose, to say every time, every session, every day, I have no idea where we're going. But I think this is what we owe people, because that's how you make room in the clearing for them to bring whatever they want. If we predetermine, we start to fill the clearing with our own stuff. So if I say, well, how did that go last week with the smoking? I've already set an agenda for today, and I've already brought in something that you may or may not wish to spend your precious time with. So I've hijacked our session, and that's a problem. Let's see, a couple more things here. Opening possibilities means all possibilities, of course, not just what we might say the good ones, but to open the freedom of all of what can be. Liberation does not mean without consequences, without possibilities of suffering or pain, or the making the so-called wrong decision. In fact, because the opening opens all, everything is at stake, and everything can matter in significance to each and every Dasein. I have a couple questions that I'll put in the chat, and we can come back to these if necessary. But I'd like for us to reflect on the times that you actually feel heard by people in your life and what was going on in those encounters. We can look at those phenomenon a little bit together. What happens when you feel missed by people, like they don't, as much as they're quote unquote listening to you, you feel like they don't get you, they're not paying the right kind of attention to you. And I want us to ask a little bit about what we open and close to in relationship. Roberto, would you kindly share the image? This is a comedic moment. We'll take a comedy pause for a second. For those who are familiar, this is Gary Larson's work. He's from the far side. And this is an analysan sitting looking at a quote unquote Rorschach test. And it says, "It's just a simple Rorschach inkblot test, Mr. Bromwell. So just calm down and tell me what each one suggests to you." And this is, of course, leading the witness, right? Thank you, Roberto. So we we just have to be careful. We do this all the time, sometimes by mistake, of course. Let's see, a couple more pieces here. I'm going to read to you another quote, but first here, we must not believe that we know anything about the terminology, the syntax, the ways in which people choose to express themselves. And keeping up with the times of lingo and being urban dictionary experts will not save us from what is essentially human. To make space for another's experience to be truly and non-judgmentally realized in the here and now of the Dasein to Dasein encounter. We really have no idea what people mean with their words unless we take the time to unpack them. Classic example would be, a person says, "I'm depressed," and I don't actually know what that means to them. And I know the DSM fairly well, unfortunately or fortunately. I can guess at what, other people have said about depression, but I don't know anything about what this person has to say about it yet. And that takes time and an investment in that person. This is a quote from Todd DeBose here from Being Lichtung, his chapter. He says, "The theropoet, which is his terminology, therefore attends to the presencing of the intangibles in the presence of tangibles. The coffee cup is more than just what I can see and hold as a literal object in my hand. It is also the significance of the cup that makes this cup unique. It is a gift from my daughter and son. It is a nurturer of comfort in a ritual of imbibing a warm beverage at sunrise, or as a chalice in the sacrament of the coffee pot while sitting vigil with someone visited by the tragic. The beverage and warmness are tangible, while gratitude, comfort, and the quality of bonding are intangibles. There is no generic cup, as there is no generic way of being in the world. Indeed, each cup is there and here as an object in hand, but also there and here in its existential significance. We do not have to find existential significance, nor create it ex nihilo, as it is never absent. We just have to learn how to heed it." And this is an example, I thought, of allowing the phenomenon to show itself. If we assume we know what a person means by when they're talking about a coffee cup, and we move on very quickly, we don't actually get to see what matters to that person. And in essence, we have to be thoughtful of how to open up room for the discussion. Let's see what else here. Miles and Tomas often speak of this in the way that the content also is not as important in a sense as the relationship itself. So some people might say, well, why would you pay someone to talk about a coffee cup? But why not? If it's what matters to you and it's one of the most important things that's showing up in your reflection of the day, that's exactly what we should be talking about. And not necessarily some other agenda item that is a hangover from the last session. This invitation to be with is enough. The opening that is there is enough. This is the therapy, not what is talked about, even though, again, that can help a person gain some self-understanding or perspective or work on a particular problem for themselves. But we're not advising anything. We're not expert giving advice about something. Instead, we share the view and help a person be willing to look in the first place, where we invite them to take a look. This is incredibly difficult, again, as the tendency to help, inform, support, guide is strong within those that want to provide something that feels good to the problem at hand. People suffer and they want to not suffer. Even the best of intentions, however, may close down possibilities, might hedge that person in. The skipping ahead, the helping can actually be harmful, and we want to be, again, mindful of this. Just one more quote and then a final comment, and then we can open this up for some discussion. In the Daseinsanalyse Jahrbuch, number 40, Miles did a pretty incredible thing. For those who have read it, you probably saw this already, but he interviewed some folks from sort of the historical Daseinsanalytic tradition. Alice Holzai-Kunz is in there. The one I want to quote is Konstantin Gemenetsis. And then there are several others. And Miles has worked very hard to preserve the voices and the lived experiences of some of these folks, several of whom knew Boss, maybe even knew Heidegger at one point. This is from Constantine, and I think it highlights kind of the theme of today. I'll put this also in the chat for you. So he is reflecting about his journey with Daseinsanalysis himself, and he says, a small circle of psychoanalysts was gathered around Boss, forming the so-called Zurich School of Daseinsanalyse. I participated in this circle for about 10 years, where I did my training and worked in its spirit. In a seminar hour, he said en passant, what do neurotics need anyway? Just a little love. The issue here is not primarily the respective phenomenon, but the attitude of the therapist. In this regard, Hans-Peter Padrut took up two words from Heidegger and repeatedly placed them at the core of the psychotherapeutic event. Zuvorkommende Zurückhaltung, anticipating restraint, and Zärtlichkeit, tenderness. He utters the unbelievable sentence, phenomenology is tenderness. And to play just a little bit of devil's advocate with myself, I don't know what tenderness means to Hans-Peter or what this means to Constantine, but I know a little bit of what it means to me. To be soft in greeting, to be taking in something, and to be sitting down for a while with something. And this is what I wish to provide in a safe haven to the people in therapy who are willing to spend some time with me. And I appreciate, again, having spent time with you all. So this is my presentation. I know we have a chat comment, so we can get to some discussion. Let me read the chat comment first, perhaps, and we can go from there.
Yeah.
From Naim, it just came to my mind while hearing, suffering has been led with uninterest when it comes to the phenomenon experienced, while being and bending ourselves to the analyst's ends in order to reach them, providing them such an interested hearing seems to be quite respectful and helping. It would definitely set an open opportunity to let them speak, think, and mean what they've thought. I think that's exactly right. Do others have anything to add to that comment or to ask about that comment?
Yeah. First, thank you, Chris. It was a very inspiring lecture and webinar, talking about respect, even talking about personal experience, and it was really great. I completely agree with Naim, and I guess it adds to what you were talking during your lecture. Like respect given is the fact that we can always be present. This kind of love that permits or enable the analyst to be themselves, to talk about whatever they want. And I don't know if anyone has comments or wanted to add comments. Just raise your hands in the chat or on the Google Meeting platform. But I have another question. I don't know if you want to reply to Naim's question or if we just...
Sure, happy to say a little bit about it. And again, even in just an example of phenomenology, I would wonder from Naim what some of these terms actually mean. To get to deepen the question. Suffering, for example, and wondering what bending means. In particular, because I do think some of what we engage in the therapeutic relationship starts in terms of our attitude, in terms of our preparation for the day. Tomas and Miles both speak constantly about this, and I do believe this, is that some of maybe the difference for Daseinsanalysts is that these are life perspectives, and you're living this way much of your quote-unquote civilian life. So we're not, surgeons who put on the gowns and wash up and then we're ready for surgery. We are instead taking on a philosophical perspective of what it means to be human, which is not something we necessarily put on and off when you get home for the day. You take off your Daseinsanalytic view and you put it on the shelf for tomorrow. But in terms of the, maybe in this question, it's really important to understand that setting an open opportunity, as it's described here, is an intention. It doesn't, like, we could take, again, these other interventional ways of caring for someone, and again, slip into those maybe mindlessly, just out of our own rush or anxiety. We feel the suffering, we want to stop the suffering. Maybe we get anxious about sitting with the suffering, so we want to offer it, something hopeful to make it go away, make it feel better. It's much harder, I think, to be willing to sit with and not alter something, not try to change that something that shows. And so in this way, I think it's about how we are working on this in our lives altogether. Are we people, and that's difficult. We're called to things, we care about things. The essence fundamentally as a human is we give a damn about stuff, as I love how Miles puts that. We can't help it. we get caught up. We're emotional. We get fiery. We get passionate. We have values. But in the case of our agenda, in what we do in this space, we have to come back to that again and again. What is the purpose of this? Now, it's not to say that intervening is bad. I can't emphasize that enough. When my car breaks down, I go to the mechanic. I need this person to fix my radiator, not listen to the radiator express its experience about life. I'm not paying that guy for that, if I have to fix something, there's lots of things in life that require these other forms of caring. It's just for this intention, we're offering the alternative. We're really giving, and I will say, and I wonder what Miles and others might say about this, but it seems that less and less are people getting this in other places in their lives. So whether that's the way modern day feels accelerated, or technology has an impact, the rush, the hustle bustle of modern day life, the way people are interpersonally with each other, whether they're very separated, isolated. But this is a very unique thing that I don't think everyone has. And even though every person has this as an offering, you don't have to be a psychologist to offer this. For example, there's a lot of people, I think, who do offer this unbeknownst to themselves, offering it. They've never heard of Heidegger, but they are human after all. But there, I see a sort of maybe an epidemic of loneliness around this issue, that people don't have a clearing space to just be allowed to be, and to sort of guide their experience, their expressions of their experience.
Thank you, Chris. I was wondering, I want to ask you something and then ask you a practical question. But when it comes to this, when you were at the healthcare center and fix the problem thing that you were asked to by the doctors, and you are more interested in what the analyst or the patient needs, or what they are calling for, what they are needing. And when it comes to the private practice, perhaps this can be an ask for the analyst, right? I want to fix a problem. I want to make a decision. I want you to help me to do something. How do you deal with these needs and asks? How do you provide Daseinsanalysis, even if the analyzant are asked for something else?
Yeah, yeah. Let me see if I'm pretty sure I have your question, but let me make sure and clarify. You're asking if a person comes in with a request for the goal of the treatment to be something like advice giving or a directed approach, like a skill development or something like this. Now, in my private practice, just to get started, I do two types of therapy. I do offer third-party payers as an opportunity to see some people, and for two reasons. One is when I left the health center, I had several people want to continue with me from the health center. And these are many people who cannot afford private pay therapy. So they are on Medicare, Medi-Cal, private insurance. And so I thought, you know, for two reasons. One is for myself to have an opportunity to see some people and continue the work. But another was these direct requests of people that wanted to continue with me. So when you're in those systems, you're still required by law to do some form of medical necessity for care. So they all have to have a diagnosis, and they also have to have a treatment plan. So they have to have a written plan about what specific, again, linear goals you're working on in treatment. It's a very different approach. You know, it's a very medical model. It's the intervening care as a priority. Now, that's not to say that I don't bring in way-making opportunities in those sessions, but those goals are very different than doing Dasein analysis. It's not Dasein analysis. By nature, it has not been allowed to be Dasein analysis then. So I bring in some, of course, phenomenology and some exploration of their meaning. But if they bring in those goals, you know, I have to make a choice. Now, what I will say, and we have a couple more, we have another comment we'll get to, but I'm at a point in my practice where I really am trying to only take Daseinsanalytic interested people. So if they want to do analysis, I'm trying to create space to see them. And I'm not really taking people who just want to work on, let's say, traditional skill development. I refer them. You know, I know a lot of people in the community that will do that work with them, and then I tell them if they want to do something different, I'll be available for something else.
Do you think that Daseinsanalysis are getting more popular in the USA?
I mean, yes. I think that actually a lot of forms of my personal view, I'll say that, in my humble opinion, one person's perspective, people are not sold on the behaviorist models. I think they're wearing thin. I've heard a lot of people come to therapy who have been to many therapists over many years and have said that they're not satisfied with the treatment. They would not see themselves as quote unquote better. Like the symptoms still remain, the concerns, the stress, the perspectives they have on life feel like they've not improved. This is a whole host of interventions too, by the way, not just CBT, but you know, traditional homework-based practices, let's call them, where a patient, you know, gets an assignment and goes home and fills out something, and because again, it misses what the point is. That assumption is that it's an intellectual problem. You need to know something or learn something to do better. So the belief is that you're at a deficit and you need to, you know, fix and correct that deficit. Most of those people going to those therapies aren't stupid or lost, or they may be lost. They're not incapable of knowing things. That's not actually the issue. The issue is that they've never had maybe an opportunity to be with themselves in a certain way. And so what I often find is they are feeling somewhat insecure because what everyone else is telling them is not matching up with their own experience. And then if they feel bad about themselves, they take the other to be more significant than what's coming from themselves. So they feel like they're not adding up, they're not good enough, they're not achieving. And then if they're in those modalities, they also feel like they're failing the therapist or the psychiatrist, because they're saying, well, I'm not getting better. How do I tell this person I'm not getting better? I must be doing something wrong. This person has a degree and they have training and experience, and I'm not getting better. So I must be the problem. And it's really heartbreaking to hear people talk about that, to feel as though they're not as they already should be. This approach is the exact opposite of that, is that they're already everything they need to be, even if that's constricted. And so by allowing them that space and that leadership in their own care, I think we already inherently help them develop a certain self-worth and self-esteem that is around their capacity to speak about themselves and trust in themselves again and what they know of their life experience. Yeah, we could look at the question here. From Marcos, it says, I understand that temporality is a core aspect of our being that is affected by contemporary technology, as Heidegger described. I think we are experiencing an acceleration of our temporal experience. To create or properly respect the time of expression seems a truly ethical exercise and an act of respect, a form of resistance against this acceleration and its oppression of being there. Thanks for this inspiring encounter. You're welcome, Marcos. And I couldn't agree more. I do think that there seems to be it's an interesting phenomenon. I'd be interested what you all hear in your encounters with your analysts, but so many people have the forever struggle of time, which is I don't have enough, but I'm also wasting it. And so if you look at people's commitments to time, this is my, again, not to be self-deprecating, but I consider myself a forever Heidegger novice. Learning this has been a lifelong journey so far, and I have a long way to go. It's very challenging, but what I've taken away more recently is this idea that lived time is our greatest resource. It's everything, actually. It's our currency for life, for existence, and how we spend it. What you choose is maybe the most important thing. And so to have time given to yourself by yourself for analysis, for example, may be one of the greatest things you can give yourself. You're giving yourself this gift of time spent in self-reflection. And that's not, again, built into everyday life anymore necessarily. So these accelerated things steal away our attention span and our time. I forgot who it was, but Bo Burnham. I don't know if any of you know him. He's a comedian and a performer. But he was talking about the algorithm of technology, and the algorithm of technology's goal is your time. So it's going after you directly. So the reels, the algorithm, the clickbait, we don't even ask you anymore. Your next video is loading in 3 seconds. You're going to see something else, and again and again and again and again. And I find that a lot of my folks that come to talk with me, they get caught up in this. They don't know where 2 hours went. And it's not that they weren't there, but they weren't somewhere and something was feeding them rather than they were feeding themselves something. And I do think for people to stop and to actually move away from the screens, move away from, what is a distraction often in front of them, and to take that space is actually, a very important gift. I very much agree with that statement.
Yeah. Thank you again. And when it comes to the formation of design analyst, the training analysis, it's a important part. Like you have to receive, you have to be another person has to enable, has to respect your Dasein. You have to experience that. You are graduated since 2004, and there's a long time that you are a psychologist. And have you experienced this yourself back then when you are in the healthcare center? Like how do you get this calling that's not enough because when I go to my analysis, I don't receive these. How do you feel that you get this calling that what you are asking to do was not enough? Like can you tell us more about it?
Absolutely, and I'm happy to speak just a little personally about this. To a certain degree, and I'm happy to speak more offline to people if they're interested in this as well. But for the purpose of this lecture and a YouTube sharing, I've been in personal therapy on and off in my life, several different sort of modalities. At the time of some of those choices, I did not seek out a particular therapist based on their modality, and some of that might have been based on insurance or being a poor graduate student with no money and bad insurance that doesn't cover anything. And so some of the factors by which I had some experience of being a patient, a client, an analysand, have been driven by these external factors, which is very true of our people as well, right? Like not many can maybe pay privately for this type of treatment. And because we're not covered by third parties, it's not possible to get some additional reimbursement to get there. So these are barriers, very important ones. I think they're at the heart of some of our discussions on the world stage and what it means for Dasein analysis as we grow. But more to your personal question, I worked with two art therapists in my life too. I had an interest in art therapy. I almost became an art therapist, one might say. I had an interest in Bruce Moon's work, which he's an existential, maybe the only existential art therapist, so to speak, at least by his own definition, out of Milwaukee. But he had a lot of texts on this subject. I did not work with him directly, but I worked with some other contemporaries. And then of course, as part of the American Daseinsanalytic Institute, the requirement for in-person analysis, preparatory analysis, as it's called, is something that I've been engaging with since 2022. So I believe the Institute's requirement is a minimum of 100 hours of your own personal analysis. I've done somewhere in the ballpark of 65 hours with Miles as my supervising analyst. Many of these I actually flew to New York a couple times a year, and we do what I like to refer to as Tavistock analysis, which is back-to-back sessions, throughout the day, usually doing 4 sessions a day for 2 or 3 days in a row, which is a lot and not really always recommended, but given the circumstances, was part of what we could do, to get the time together face to face, person to person, Dasein to Dasein. We tended to space those out a little bit too, because it was more about the quality of those encounters. And I will say, I I don't know how many of you have been in couch-based analysis, but I would highly recommend it. It is something to be experienced. It's very hard to say what it is verbally, because it's hard to define some of what you experience that, and your experience will be very different than mine, for example. The unique makeup of these two Daseins coming together forms something special that's not replicatable. So, you know, if we were to, let's say, tape, you know, my sessions with Miles in preparatory analysis, that's what it was for that moment, for that encounter, for us. It's not what it's going to be for everybody who comes in to do analysis with Miles, for example. And so, you know, there's something to be said about what you can generalize versus what you can take away in your own experience of the work. But certainly you've done some dream analysis on both sides of the couch. I would say right now I have somewhere about 6 or 7 people in my practice are doing couch-based Daseinsanalytic work, you know, every week. Now we've gone to Zoom-based for some of our sessions to see. That is, I think, something in the Daseinsanalytic community that's being explored. You know, what is that like, you know, to be, you know, physically far away, but existentially close through the technology. The way we've practiced so far has been the same setup. So I still lay on the couch. I still, for myself, I prefer to close my eyes. I have earbuds in. Miles is on the other line, you know, and he is in his same, you know, he's in the New York sort of analyst position, you know, listening and being with me in those experiences. So, you know, and I find them still very meaningful and important in my life and my practice.
It's nice that we are pushing the boundaries, you know, in this regard of virtuality and in-person sessions, because I think that is the new reality, you know, like we are, there's no other way to give this lecture if it's not online, you know, and so at sometimes people wanted to see it as an analyst, and that's what we can offer, you know, like lay on the couch, close the video, and
Yeah.
let's see what's going on. And I like that. I like this pushing the boundaries and reinventing Daseinsanalysis. And I was about to ask this for you, you know, like how do you perceive, or how do you think that's possible to build your own personal style in Daseinsanalysis? You know, like you have a art background, art therapy and existential therapy, humanistic therapies, and now you are doing therapy with Miles and studying phenomenology and Daseinsanalysis. But how do you think that merges, and how do you think that's possible to transcribe in your own personal style? You know, like you think that remaining silence is a thing, it's a goal of every Daseinsanalysis, or as Daseinsanalyst, or you think that's a personal style, you know, like you don't like to interfere, so you stay more quiet? How do you perceive this in building your own personal style in Daseinsanalysis?
Yeah, a great and important, I think, forever question, actually, not just a one-time question. But if I hear you right, Roberto, you're asking, you know, we come from so many places and things that have mattered to me at some point. And of course, I'm my own person. I'm a unique human, as it were. And how does that come into my choices about how I meet people in Daseinsanalysis? And this is not to be sort of a smartass or anything, but it's impossible to answer because I don't know who's coming in, and I don't even fully know myself every day. So I'm meeting those two in relationship, myself and another, every single time. And so I can't predetermine an answer about how, let's say, how talkative I will be, or how silent I will be, or what is there. What I do try to emphasize, I suppose, would be an openness to meet and listen very carefully for what is here. So I guess we could call that a genuineness, or a patient curiosity is kind of a term I'm playing around with. But to be open means to really suspend. And again, from the respect position, I think I owe it to people to not know what we're going to do yet until they come in. And even people I've worked with for 10 years, I have some people from the health center I met in the first couple of years I was there that are now in practice with me. And I really try hard not to predetermine them in any capacity as they enter the door, even as I've known them now for a very long time. And, so I do believe silence plays a role, because if I'm listening and really attentively making space for the other, I can't be filling it with my own talking so much. But that's not to say I don't talk in therapy. I do. What I find, and I'd be curious to look at this more closely in myself and in discussions with you and others, is you sort of lose yourself if you're doing therapy well. Like I don't feel as much a separation from the other when I feel I'm really engaged with them in the discussion and in the exploration. And so just as we have seen across all the existentials, time changes. I mean, these are not linear experiences. They're not, sort of practically speaking, we're not following any agenda. I don't have a goal for them. I'm not feeling like, oh, we're running out of time, I've got to make sure I tell them this, brilliant, thought that I had or feeling that I had. Sometimes we laugh. Sometimes, I am paying attention if someone is, I don't know, trying to get a rise out of me, like something like that. But I stay curious with that rather than knowing what it means. I don't know what any of it means. It's not that you play stupid, but you understand that for every single person, they have to tell you what's going on, not the other way around. And in that way, I try to make myself available to them to show them where I'm at. I think maybe by being that open, I'm also modeling something of that to them, which, I am human. I'm not always having the greatest day of my life, in therapy. That would be strange, I think, actually. I don't know if that answered your question, or if you have any other questions related to that, Roberto. But
Yeah, for sure, sure does. But I was thinking about the topic that you bring up today. Like respect given, and when it comes to this regard, I was thinking about respect receiving as well. Like we don't have to pretend to be another person. We don't have to pretend to be the person who knows everything. And I think this is just like Tamash usually said, like it's a way. Daseinsanalysis is a way of being. Being a Daseinsanalysis is a way of being. It's freedom. We are free and we are there. We don't have to have a goal. We don't have to have a pursuit. We don't have to have topics to rise up. Because we have on the past session, it was important in the past session. and what's happened, and I get this release, like almost like respect giving to myself as well,
Yeah, 1,000%, and I've heard some incredible talks from some of the folks from Greece that are in the Daseinsanalytic community. They talk about, and they will spend, many books and articles on serenity, Gelassenheit as the core principle, because it's your own comportment that makes all the difference. I think people feel, I mean, think about yourself, when you go into a place and you meet someone, from the beginning you kind of feel, do they have an agenda? Do they need something from me? Are they trying to get me to do something? Even if they're polite or nice or kind, and it's quote unquote good, but is there an influence there? Are they trying to have me moved in a certain way? And this is different than that, because the starting point again is about curiosity. I just want to sit with you and see what happens, and I don't again know where we're going to go. Now, to your earlier question, there are a lot of people where this is in the beginning shaping the expectation of what you're doing for them. A lot of people think you are the car mechanic because they've been told you are in society. They've been said, well, go to a therapist, they'll help you fix your problems. And so they go to you and they come to you saying, I need to learn how to take my anxiety away, or my depression, or my suicidality, or my OCD, or whatever is going on, or fix my relationship. I'm struggling with people. I need to know what's wrong with me. And so there's a great pressure, and that's where the anxiety of the therapist is really important to pay attention to. I think we feel a tremendous amount of pressure to have to face that directly. And if we're not prepared, I think you get kind of bulldozed into feeling like, oh my God, I've got to do something else for them. Like a self-doubt that what we're doing is not enough. And that's a dangerous place, I think, to be in, is in between, because the commitment to one way of caring for or another is really essential. I don't think they coexist in the same relationship necessarily so well. Maybe they do. Maybe they go back and forth. I could think about that more. There is a passage that I didn't know if we have time for, but I didn't bring it in my lecture, but I did mark it. And this again comes from this newer text, Being Therapeutic, which we are. And this is Miles's chapter on Daseinsanalysis, and talks about the phases of Daseinsanalysis. So proposes we're kind of in phase 3, which I agree with. But he says, what are the goals of Daseinsanalysis? This comes up a lot. And these are 2 ways I thought this was well described, which is hard to define because, again, the goals aren't necessarily as predetermined or as set up by the therapist alone. But these are some points he makes. One is Daseinsanalysis points to the recovery of the other's present making, temporalizing. So we're talking about time and one's time. So it's really, in essence, about taking that back and owning that, having if our Daseinsanalysands have retaken accountability and responsibility for their time, and that is to say what they invest in their lives. I think that is something that we strive for. He also goes on to say, he talks about Kondraw. There's a famous case there of Odette. I think that's how you pronounce her name. And he says, in effect, to the highest degree possible, it's the own present making and the encounter between his Dasein and the Dasein of the other. In effect, he shows the other that it is possible to do this. Nothing is offered as advice. No recommendations are made. No medications are prescribed. Encounter in Daseinsanalysis is lived. The Dasein analyst is patiently open to the other, where his present making and his present making of the other meet in the moment of the encounter. And again, I think this emphasis is important to come back to again. It's very simple, but it's very hard. Is that the goal is to be together. That's it. That's it. Full stop. You know, and I think people wonder if that's enough. You know, you go, oh my God, is it going to count? You know, will I get yelled at because the person's going to say, well, we didn't do anything. And that's right. We didn't. Because the doing versus being, this is another spectrum that a lot of Eastern traditions look at, of course. Taoism and Buddhism talk about this a great deal. Contemporary psychology is all about this right now. You know, you can find lots of YouTubes and things on this by people, but the essence of what is the goal and what we're really practicing and encountering is that being with is enough. That is enough. That you are everything you need, everything you are, being present with that is enough. And that is a very different, again, way that people often experience interpersonal relationship. A lot of people go to their job and there are expectations. You have to perform. There's a production requirement, you know. How many units of capitalism are you producing every day? You know, that's built in. And this is different. This is the opposite. There is no requirement of you. I have had sessions, for example, and this took a lot of practice for me to work on myself. But I've had sessions that the person has come in and laid on the couch and not spoken a word for 25, 30 minutes. From the beginning, not a word spoken. Now, somebody watching this might say, you're getting paid to do nothing. You didn't do anything. But that's bullshit. That's not true. You know, because we are already in an encounter together as they come into the room. And I will tell you, if I had interrupted them, then I am taking over the clearing. I am filling in where we're supposed to go. And how could they experience me that way? They will then feel a pressure to either reject my suggestion, accept my suggestion. I've already kind of taken over that space for them. So it is essential that I don't do that. And I instead allow them to do what they need to do. Now, you know, that takes a certain type of patience and a certain type of practice and maybe a certain type of training, I guess, or I would say it's more about, again, your view of what you're there to do. But in giving them that fullness of respect, it's actually a lot easier to get there because it's their time. It's not mine. So if they need to use it in silence, so much is happening in their capacity to do that. And not that I'm giving them permission, but they're taking their own permission to do it that way. And that makes all the difference. That's a person standing up, you know, standing tall. Heidegger talks about this a great deal as a personal responsibility to life. The indebtedness that we owe is to do this. And this is just a small way they do that in the session itself.
Really nice, Chris. Thank you for this. And yeah, I think that in this respect giving and respect receiving, allowing the other person to be themselves, we are also allowing ourselves to be ourselves. You know, it's a releasing. I don't know. It's a free. It's beautiful. You know, like you don't have to pretend to know everything, to have responses to everything. You just can be there in silence and giving space for the other person to occupy or to do whatever they want. And I was about to ask you about a practical question, like when you say that you don't bring up the question from the session before, like I don't want to make a continuity. I want to know what this person are bringing me today, now, and I don't know. Perhaps the person brings a very important thing in the last part of the session, like the last minute, like a huge thing, yeah, I'm cheating my wife, and go away, and goodbye, see you next week, like even if it's important, you don't bring up on the next session, like you don't make a continuity about this topic. You just let the person be themselves, even if they say next session I'm gonna kill you, Chris. I'm gonna break my gun. I'm gonna. How do you deal with this?
Yeah, that I might not forget. Yeah, all joking with that aside, but the first question is a great example, right? The classic, we know this as the doorknob phenomenon, right? So that the time window is closing and they feel pressure, and they probably had that on their minds. Well, maybe they had that on their minds in the beginning, or even the days leading up to the therapy. Oh, I want to bring this up, I want to share this. But for whatever the reason, and we don't have to know what the reason is, it came and showed itself in the last 30 seconds at the doorknob, as they walk out the door. Now, if I say something about that, I may be interpreted as judging it as, well, why did you, like accusatory, why did you do that? Why did you wait until the last minute? Now, that person and I were both there. We experienced what happened. So I don't have to necessarily point it out and remind them. And I think what is most relevant will show itself when it's ready. So if they bring it up in the next session, of course, we're going to talk about it. But if they choose not to, what does it mean if I choose for them, again, to bring that in because it's my agenda? Now, I will say, I'm sure, I guarantee there are times I've done that. Will I say that I was following a true Daseinsanalytic phenomenological approach? No, because in its essence, I've filled the clearing with my issue that I want to talk about. Now, that's not to say a person might not feel heard or respected or like I care, because they might feel those things. But I have brought in a little bit of that intervening way of caring for them, because I've chosen what we're going to open to together. And if I choose correctly, let's say, maybe it doesn't cause that much of a rift in the relationship. But I have to be careful, because if I choose wrongly, now I've already set up some form of a possible shaming of them, or feeling bad, or like the essence would feel like, well, we have to talk about this. It must mean something negative to your life, which may or may not be the case. This is like a joke example, but like, let's say an animal exam comes in, they say, my mother passed away, and you say, oh, I'm so sorry for your loss. And they say, no, you don't understand. I hated my mom. She's terrible. She abused me. Awful person. She's evil to me. Now it's awkward. I've already like gotten lost in the phenomenon, because I'm assuming too much. I already thought, oh, she's devastated. No, she's rejoicing. We are far apart all of a sudden. And in 5 seconds of time, I've already screwed up. So I have to. This is why it's so simple in its origin. It's so hard in its practice. You have to really suspend what you think you know about what's going on, because it's not about where you're coming from with something, it's about where they're coming from with something. You know, so even in this example, he says, I'm cheating on my wife, I think he said. I don't know what that means yet. I have no idea what that means. You know, it's a small statement, actually. It's not as, I don't know if it's a big deal. I might assume that, but I need to bracket any of those assumptions that come. Now, you know, like other forms of therapy might say, well, no, you know, it must mean that he's repressing it, and he's feeling ashamed, and he doesn't want you to think badly of him, and all the, well, I don't really know that. So I don't worry about that so much. Because if it's important, and if he and I have built that therapeutic Dasein to Dasein relationship in our goals together for therapy, it will come, and it will come on his terms in the way it needs to come, in terms of timing and detail. Now, what I will say is I do often ask them for elaboration. So tell me more is something I say a lot. Help me understand more of what you mean by this. You know, I don't press any particular direction other than trying to unfold, you know, what they're saying. But most of the time I try to get out of my own way, honestly. And I'm more trying to, again, hold space for them to show us both what they need to.
Really nice. Thank you, Chris, for this really nice lecture, presentation, and for being so open to give us personal aspects of your practice in life. And Pablo, if anyone has a comment or anything.
Yeah, please.
Yeah. No, Luciana? No? Okay. I think they are clapping hands. And
Very nice.
they are all here, you know, like they are. And
yeah.
Chris, you know that this is gonna be recorded and shared on YouTube. So if anyone around the world are watching this, how they can reach you and see you for further questions and perhaps Daseinsanalysis, how people can reach you.
Sure. Best way, probably through my email, Sethness, my last name, Sethnes, Psyd, Psyd @gmail.com. Happy to talk with people further. And also just to, again, emphasize, you know, the points that, you know, I do firmly believe that this is how we give respect to others. And to say, you know, I thank you all for coming here. And I have great gratitude that you'll spend your very precious temporal currency with me for your Saturday. And I wish you all well in your journeys forward. I look forward to talking with you all more as we connect on the international stage. You know, we bring Daseinsanalysis its due and move this forward.
Thank you, Chris. Thank you all. Thank you, people, for being here. This was the last International of 2025. Luciana, our thanking for the presentation. Thank you for being here. And yeah, see you on next EDI classes. And bye-bye, everyone. Thank you.
Bye, everyone.
Take care.